Hello, everyone, and welcome to the Global Health and Purpose Summit. Thank you for joining us today for this very important discussion on using community drivers of health to deliver whole person care. My name is Sarah Harper, and I'm a senior account executive at Finn Partners. Today, I'm joined by Meghan Harris, President and Chief Operating Officer of Essentra Health, a 20-year industry veteran with a background in mathematics and statistics. Meghan has been the driving force behind Essentra's operational excellence and impressive record of clinical and technical innovation. I'm also joined by Dr. Ryan Bosch, Chief Health and Informatics Officer at Essentra Health. Ryan leads the company's effort to integrate advanced analytics and modern technology with clinical practice, drawing on his extensive background as a physician, health IT leader, and Air Force veteran. Meghan and Ryan, it's great to be with you. Thank you guys for joining me today.
Hello, thank you for
Thank you,
having us.
Sarah. Thank you very much.
Yeah, absolutely. All right. Well, to get started, I would love if each of you could just share a little bit about your background, what you do at Essentra Health, and a little bit about your passion and how you came to the healthcare industry and, what's made you really stick around in this work for so many years. Meghan, why don't we start with you?
Happy to. My background is really health analytics as well as biostatistician by trade. I don't do a lot of that work anymore, but I am still very passionate about the healthcare system. I encountered it very early on in my own life. And what I'm really passionate about is that we really get an opportunity to encounter people really when they're at their most vulnerable. When you think about going to a doctor or getting a diagnosis, you're really at your most vulnerable part of your life, and having the opportunity to engage people at that moment and make that part of their life just a little bit easier is something I feel very strongly about.
Mhm. Yeah, absolutely. And Ryan, I'd love to hear about you.
Thank you, Sarah, and thank you for having us. We're excited to be here. My name's Ryan Bosch. I'm an internal medicine doctor by training. I'm the Chief Health and Informatics Officer at Essentra Health. In that role, I'm fortunate enough to use my background as, again, an internal medicine doctor, a technology and data expert from coding back in the day and being involved in technology earlier in my clinical career. And also 3 decades of experience as a healthcare executive across both the academic setting, the military setting, as you mentioned, as
Mhm.
well as commercial, and now in the public sector. My passion is data. I very much compulse as the stereotypical internal medicine doctor compulses on data, and data to action is what really drives me from a passion standpoint.
Yeah, absolutely. Well, I'm looking forward to chatting about that topic today. Thank you both for these introductions. Megan, I'd love to start with you with our first question. Whole person, whole population care is an approach you both champion in your work at Essentra Health. How would you define whole person, whole population care, and why is it important?
I think what's most important is that evolves as we get smarter and use data, as Ryan said, to really evolve things that impact people's health. I think originally, as a company that was traditionally in sort of the medical health care, we very quickly realized we needed to have the behavioral health aspects of somebody's overall well-being as well as their pharmaceutical, and then quickly realized that wasn't all that was important really when somebody's trying to seek out healthcare. That really additional things like their socioeconomic statuses, their family support systems, and availability of resources quickly became one of those other items that really impacted somebody's healthcare. And so as we've evolved as a company and evolved thinking as a society, all of the levers that impact somebody's healthcare really need to be addressed in order to really impact somebody's well-being long term.
Hmm. Yeah, absolutely. Ryan, what about your standpoint as a physician and, in your role in Chief Health and Informatics Officer?
I think the depth of the whole person, whole population model is best described in its dimensions. Megan spoke about the 360 degrees around an individual or a care episode, whether that's behavioral health or physical health or pharmaceutical health, or even the individual health related community needs of a person. But there's a whole nother plane, if you will, in that view, and that's how do we look at not just the whole person, but the whole community. So the coming together of those two perspectives, the community itself has a inherent lift or an inherent obstacle that it provides on an individual or a group of individuals as it relates to their health. Things like access to healthy food, access to medical care and medical clinics, access to the tools of navigation and health literacy. These community drivers are just as important as that individual 360 degree. And that's why the whole person, whole population health brings it all together.
Yeah, absolutely. I think that 360-degree view can often get lost. And I think it's so important the work that you're both doing to help bridge that gap. I think, especially when we think about data, this is a great segue to our next question. Ryan, how does data play a role in helping providers and state Medicaid programs and commercial partners close care gaps? And what role do those community drivers of health play in the process?
So data is king, and I feel it's such a cliche to say that, but it is still paramount to our process. Yet it remains at times very siloed. It
Mhm.
remains fragmented. It's abundant now more than ever, yet it needs structure. It needs that Rosetta Stone analogy to bring us into information. We're
Mhm.
not yet to knowledge. We're trying to get to information collectively in the marketplace. So what we see is a need to structure that information because unfolding before us, probably for the first time in my career, is an intense amount of compute power with cloud native technologies, with the ability to go beyond what are the limits of an Excel spreadsheet. We have power to make information out of data. And thus, we pick up a charge that we need to have a verve towards action. We got to do something with it. It's not just to store data and have data lakes and have data processes. It's why do we want to do this? And in my career, I've seen data from electronic health records. I've seen data from EAP systems, caring for beneficiaries. I've seen data from health information exchanges, the rudimentary ones to some of the more advanced ones now. And at Essentia Health, we see data around the Medicaid and public sector space, as well as commercial and Medicare. So all of that data is abundant. We really need to accept that charge and push it to action.
Yeah, absolutely. I think the healthcare industry has such, an ample amount of data, but we have to be able to use that to, make measurable improvements for patient populations. Megan, how can healthcare leaders begin to incorporate community drivers of health into their program development? And how can we convert from simply gathering the data to making it actionable and an essential part of the program design?
I think it really starts at the beginning. We are not yet adept at creating programs, intervention, community resources that really address the whole person. So we still create, case management programs that are specific to a condition or programs specific to mental health or foods programs specific to foods, right? And so if we really want to effectuate change as healthcare leaders, we need to have our programs at the time of development to be able to address that whole person and that whole community, or we'll continue to miss the mark. We'll continue to use data as an after fact to explain why something didn't work, as opposed to use it as a lever on how we can create these programs in a way that are more impactful to our communities.
Yeah, absolutely. And I think what you're both getting at is really that health equity component. I think we need to use that data in order to achieve health equity for those vulnerable populations. Ryan, inconsistent data is often a barrier to health equity, as you both have mentioned. How do you ensure that data is high quality, clean, and actionable so that state Medicaid programs or even commercial clients can help close those care gaps?
So, Sarah, around the shop, around data fidelity and data liquidity, we use a term about data discipline, and it takes conformity to innovate. And all those big words mean the more discipline you put to your data, the lineage of the data, where the data was confirmed, how it is brought through to your display. This is the blocking and tackling that makes the conclusions valuable, allows you to actually feel comfortable with correlations and causations because the data has good fill rates, it has consistent nomenclature, and it has a method to update itself. This discipline around data is what our team is inculcating across our system.
Mhm.
Ultimately, you'd say, well, why are we doing that? Well, because the disparities that are out there are by age and gender and medical condition and race and region and geography, whether it's rural or urban, we're able to get to the data and segment that data based on risk and then really apply scientific method to discern whether the interventions provide lift. We're very fortunate, Megan and I, because we're close to claims. We're close to the outcome measures. We process claims, inpatient, outpatient, for our customers. And that gives us outcome measures within our own systems. So we really have an ability to be scientific about the intervention affecting the outcome. And I think it's that data discipline that helps us address any inconsistencies because the iteration, it sort of vets that out. You've got to then look back at it and say, well, do we have good fill rates? Do we really have that? Do we have the right data at the right place to make that conclusion? So this is a bit of the stuff we compulse on, but I think that's why we're really seeing movement here.
Yeah, yeah, absolutely. Um, Megan, I'm curious from your perspective, with new CMS mandates and the shift towards health-related social needs on a broader scale, how is the relationship between policy and technology changing?
I think it's fascinating. I think it's still in two separate buckets at times because we have yet to really figure out like two paths going, right? And one is CMS is very much about interoperability, the ability to share that data more broadly, more widely related to an individual or to a program. And so a lot of work is being done there and a lot of really good work is being done there, but it's still behind, from where it should be at this point, given how much data that we do have. And then there's a lot of policy items related to freeing up people's time so that they can really spend time on healthcare. The rural health transformation that CMS has announced, that the states have applied for funding for that really address our more critical areas where we don't have the number of providers or the types of facilities that we need in those areas. So I think they're still a little bit divergent. I think we have work to do, and that we shouldn't just be relying on CMS. I think all of us as healthcare leaders own this problem, right? We have great programs, we have great technology. Technology should be used in a way that really helps us innovate and bring those programs forward. I think we're making major steps forward, but I still think there's some work to do.
Yeah, absolutely. Ryan, I'd love to hear from your perspective on that question. How do you see the relationship between policy and technology changing?
Well, I think Megan's right to acknowledge the dichotomy there between technology's modernization push and somewhat of the claims-based world we still live in. It's formatic, it's structured, whether it's inpatient care, outpatient care, pharmacy care, they are very structured documents that process and adjudicate those claims.
Mhm.
That being said, I think we're starting to see that with technology and data discipline, it's not just a linear relationship. Oh, it's food as medicine. Oh, it's a diabetic. Oh, they're in a rural part of the state. Let's look at those factors and offer a program that we hope they opt into.
Yeah.
None of that is ill-intended. It is actually all relatively proven in each of those components, but it remains fragmented. At Essentia Health, we're lucky we have 110 million lives under contract across all of our customers. So when we deliver to states, we have a chance to think about how do you connect that data and you can recognize that the whole person, whole population model is more than just a food as medicine program for diabetics.
Mhm.
Frankly, that sounds like a segmentation for shoe sales, right? We can learn a lot more about risk and then we can look at the other side of it, Sarah, which I find particularly exciting, and that is who's going to benefit from this engagement or intervention? We're so risk based. They are high risk. This group's vulnerable. That person with that disease. That all that's true. But then how do we know what we did actually helped, right? Are there certain groups that are uniquely receptive, socially, clinically, community wise, to said benefit or program? non-emergent rideshare, food as medicine, access programs for cancer patients. How do we treat that side of it more with data as well to find who would benefit most from the type of care management, disease management, utilization management that we do?
Yeah. Yeah, I would love to hear from both of you, or if there are any kind of concrete examples or stories that come to mind of maybe programs that, you've seen at Essentia Health, that have addressed some of these needs.
I do. I think very specifically, we've worked with the state of Oregon around ensuring that when there's wildfires, right, that air purifiers are available, especially for those who have chronic lung conditions, air conditioners for people who have other chronic conditions. I do think there are very innovative programs out there. We use data to understand who would need such programs. The we use geodata to understand where they're located and where they're impacted by all, these natural disasters, and then bring those two things together through really, targeted case management efforts to make sure they can get them. I think it's a very unique and interesting program, and one that really is a model for where other states could look at improving healthcare overall.
Yeah. Yeah, absolutely. Those are some really important examples. As we talk about technology, I think automation is so prevalent in, the healthcare industry and so many other industries right now as well. Essentia Health really sits at the center of this public healthcare transformation. Megan, I'm curious, how do you use advanced analytics to ensure that as Medicaid systems become more automated and efficient, that they still remain human-centered?
I think it actually allows us to become more human-centered. So when I think about what automation and data can do for people delivering healthcare, it's really taking the information and having it at the fingertips so that they can be here one-on-one with a member or with a community. I think, again, mentioning back to we are all going to encounter the healthcare system. We have family members who encounter the healthcare system. We have the opportunity to really enhance that interaction so that everybody gets the most out of it, the patient and the clinical provider. Data should be used as a way to have information specifically about an individual. Automation should be used to reduce the non-clinical stuff the nurse and the doctors have to do, right? It plays such a critical role to enhancing that patient-centeredness that I think that keeping that in focus will be super important to all of us.
Yes. Yeah, Ryan, how do you see automation intersecting your work at Essentia Health?
Well, I can't help but share an anecdote with that question asked, Sarah. It's been 3 or 4 times in my career where a similar question has been asked, and I have a slide set that I've used that talks about when this happens, we will interrupt the doctor, the provider patient relationship, the care relationship. We will reduce the hands on, the human touch. We'll reduce the emotion and communication. We'll reduce the effectiveness of care of individuals and groups. Of course, in the mind, each of you, as well as our audience, is thinking, is he talking about AI right now? No, actually, this slide set is talking about the stethoscope from the early 1900s, the same exact push over this 100 years plus. I believe we've started to use computers, we started to document, we use the internet, we've done electronic health records. Google has hit us. So any one of those interventions could indeed create those same change management angst. So much like where we are today with advanced analytics, prescriptive analytics, machine learning, even I think it's got to be something where we're using all the tools we have to deliver the care that we need to do. And health is still very human, very, very human. And that I've learned over the years will always be the center of it.
Yeah, I think you both have gotten to that through the discussion. I think Megan, you hit that, the nail on the head that the healthcare system is going to impact everyone at some point in their lives, and that you really are in your most vulnerable position when you're coming to a physician's office or getting a new diagnosis. So I think that human-centered element of it is never going to go away, to both of your points. Ryan, I'll turn it back to you again. Looking forward, as we look to the future of healthcare, what is one innovation or initiative that is most promising and exciting to you, in your role as Chief Health and Informatics Officer, and then also as a physician? I'd love to hear both of those perspectives.
Sarah, they're both one and the same. It's the ability to have an outcomes practice, period. And whether that's healthcare informatics leader, as I am in an executive technology role, or as a regular provider licensed in Virginia, both, it's about outcomes. And you might say, okay, what does that mean? Well, outcome measures don't define an outcome practice. They mean you're starting to be thoughtful about how you measure what that is. Most of our work, frankly, with our clients and customers is more the business outcome measures. And they matter, period, full stop. But these outcomes have a lot more to do with net promoter scores and five nines of uptime. And did you meet the SLAs, the service level? All these are important, don't get me wrong, because we want to perform so we get the privilege to take care of health. But to really accelerate outcomes at Essentia Health, what we want to do, we need to define what those outcome measures are. These things have to do with more health for our population, more quality, more lives lived, less cost, better value, certain turnaround time measures. These things aren't what our clients are often asking us to measure, but these things actually promote an outcome measure that will ultimately become an outcome practice. This is what excites me right now, and I think we're right on the cusp of really baking that into our systems.
Yeah, I think that's really important. Megan, I'd love to hear from you as well. What innovation or initiative are you looking forward to in the future in your role at Essentia Health and beyond?
I could not agree with Ryan more. Really, how do we not only measure, but how do we impact delivery? I think that I mentioned it early, but AI and machine learning and all of those technology capabilities should be used and will be used so that those human to human interactions are very focused on what needs to be focused on and very patient centered, right? So think about a world where you have all the data at your fingertips. It's already an actionable, and me as a clinician or a nurse or a doctor or physician or community health worker can just sit there with the individual and sit with them and help them understand what's going on with them. And so the ability to use AI, to use data, to use all of those technologies that come along with that to make those jobs easier so that the individuals doing those really, really critical jobs and impacting the outcomes can be very focused on what's the most important, and that's the person in front of them.
Yeah, absolutely. I think through this conversation, you both have tied in really well of how the data can inform the programs and then can better support the patient populations and also the clinicians at the end of the day. It's really like a symbiotic relationship that you're trying to achieve among all of those things. Well, thank you so much for sharing your perspectives with us today. Thank you to our audience for tuning in. I think this has been such a wonderful discussion. You can find both Megan and Ryan on LinkedIn, and follow them there to hear more about their very insightful perspectives on healthcare data and Medicaid and all the wonderful work they're doing at Essentia Health. Megan and Ryan, thank you both so much, and thanks for help kicking off New York Health Innovation Week.
Thank you, Sarah, very much. Thanks for having us.
Thank you, Sarah.